Hello everyone. Today we are going to talk about how to discuss viral infections with the patient. So especially this is a season when a lot of patients will show up in the office with running nose and mild sore throat and mild aches in the body, and possibly some of them have significant symptoms. They might have flu symptoms like severe body aches and sometimes diarrhea and vomiting. So Noor is the nurse. She's going to act like a patient, and she will act like a patient who is having symptoms of mild cold. So Noor, what are you here for today?
I'm here today because I have this headache that comes and goes. My nose is real stuffy. I have some drainage. My throat's really sore, kind of scratching. But I haven't really taken anything over the counter for it.
You're not?
I have not.
Did you try any honey or NyQuil, Dayquil type things or no?
No, I just always like a z-pak.
Do you always like a z-pak?
I do. It seems to work really well.
Do you have any fever?
No fever.
No fever. Do you have lumps in the throat?
I don't think so. I can swallow okay. It's just a little sore.
Do you have any white patches in the throat?
I'm not for sure, but you can look.
Okay. But your running nose, is it your nose stuffy?
My nose is stuffy and some drainage.
So it has been 3 days, you said?
Yes, around 3 days.
You think it is a viral infection? You're a nurse. Don't you think you're a viral infection?
Possibly, but I still like z-paks. It always takes my symptoms away.
So, because z-pak is we usually give when we think there is a bacterial infection, when there is, symptoms of bacterial infection which are much more severe, which last longer. There must be a high-grade fever running. In flu, you can have these type of symptoms, but you are not having flu symptoms. You are just having common cold symptoms. So it is not a very good idea to give a z-pak for just mild common cold. Even if you have a flu, if the flu should be treated within 2 days of onset of the symptoms. So if you are more than 2 days of onset of symptoms, we cannot check for flu. We can check for flu, but we cannot treat, because treatment is just symptomatic then, just Tylenol and any cold medicine if you want over the counter. Usually I tell patients to drink some honey, local honey. So I think your symptoms are more of a viral symptom, viral infection, mild cold. So I don't think it is a good idea to give a z-pak.
But I really like a z-pak. It really makes me better.
So what happens is when a patient who just wants antibiotic for upper respiratory infection, and it is very difficult for us to convince them that it is a good idea to not to take medication. What I do is I give them antibiotic prescription. Usually patient wants z-pak. If they ask for antibiotics, shots or anything, I don't give that, because I do not think it is the right thing to do. I give them prescription. I tell them wait for at least 7 days of symptoms. If you're at the end of the 7 days, if you think your symptoms are getting worse, or if you think you are not getting better, then you can fill your antibiotic and take it. But if you keep on getting better, then you don't need z-pak. At the end of 7 days, usually the viral infections get better. But in those 7 days, if your condition gets severe, then either you can seek another visit with a doctor, or take antibiotic and see how you feel. At this time, I just give them, when they do not listen to me, I just give them a z-pak, but tell them to wait for a few days, because these symptoms do not warrant antibiotic treatment, because these are viral infections and we should not give antibiotic in a viral infection. Thank you.